Um, Before I get started, into my story, I just want to take a couple seconds to clarify a small point. Um, I guess it was about 4 months ago, Don and I did a TV interview to promote today's symposium, and it was portrayed, or at that time, pardon me, I was portrayed as a motivational and inspirational speaker. Well, personally, I'd rather you see me as just another guy with arthritis who has a story to tell. And if what I have to share strikes a chord with someone, then maybe I've helped make a difference. No more, no less. So that said, my journey. It started through a variety of misdiagnosis, which led me to see a sports medicine physician who was able to connect these random dots pointing in the direction of what he called an inflammatory disease or arthritis. That was the summer of 2015, and hearing that A word took me back to my early adult life where, sadly, I witnessed my uncle die due to complications of RA. It also reminded me of the misery he endured, suffering from this wretched disease, which in all likelihood, I now faced. Now, to quote my biggest supporter and lovely wife, Carrie, you don't know what you don't know. And not knowing anything of the advances in today's medication, I truly felt I was destined for the same fate. I was 51, active in reffing high school basketball, played beer league hockey, run half marathons, played senior men's fastball, co-ed community softball, and I curled. I thought, why me? What the hell did I do to deserve this? Well, after that meeting, I went home and did some research. And one of the more interesting statements I remember reading was, and I'll paraphrase, it's important to create a positive and open relationship with your specialist. And I thought, okay, I can do this. I'll speak my mind. I'll tell him exactly how I feel physically and emotionally. Well, that didn't play out as I anticipated. There was a time in this journey that I contemplated a change in rheumatologist. I didn't feel like I was being heard. And I continued to be frustrated until Carrie came with me to an appointment where she witnessed how he conducted himself. And she suggested that I approach asking questions in a different manner. I say this not to brag of my wife, rather to illustrate that sometimes a person has a bit better skill set than you and can communicate more effectively. Because coping and living with this disease requires many levels of understanding and knowledge. So if you find yourself in similar shoes, I would encourage you to do something to make a change. Whatever that change may be, big or small. 4 weeks later, I had my first rheumatologist appointment where my worst fears were confirmed. Because of my father's psoriasis, I was originally diagnosed with psoriatic arthritis, then later changed to RA. I wasn't able to immediately start medication therapy, so he gave me a mitt full of information to take home to educate myself. Now, having a chance to digest this diagnosis and the supplied info, I strangely enough felt a form of relief. I was so sick and tired of being sick and tired. It was, it was somewhat refreshing to have heard what was causing my constant aches and pains. However, that was very short-lived, and the grieving process began. And in all honesty, continues today. I was in denial, worried, frustrated, and angry. And unfortunately, These emotions put a heavy strain on my relationship with Carrie. And to a lesser extent, our kids. I'm happy to say, though, excuse me, we overcame them. Through because we understood how the disease worked. And truth be told, I'm still angry, and some days are more than others. And I'm here today to tell you, in my opinion, it's okay to be angry. Nobody needs to be happy because they suffer from a form of arthritis. You need to accept. It's what I call my new normal. Live within your capabilities, do what you can, understand your physical limits, take challenges head on, which will continue to come at you from all angles. One of them we've probably all endured is the red tape of our healthcare system. I'm here to tell you to stay the course. It's no fun going through medication protocol when you and your rheumatologist know full well what you're doing isn't helping. As flawed as our system may seem, it's the only one we have, and it will get better. I know, because I've lived it. Now, I started drug therapy in October of 2015, and I was doing okay until the summer of 2016, where at my son's wedding, I remember feeling off. Those aches and pains came back. So advocating for myself, I called my family physician and I asked to have blood work done. Well, 2 days later, I get a phone call, not from my rheumatologist's office, but from my rheumatologist himself. 10 minutes later, my GP's office is calling, asking that I attend the office ASAP. And I thought, oh my God, this has got to be bad. Rheumatologists don't call the patients out of the blue. Well, turns out my arthritic markers, or CRP, were so high, my rheumatologist thought my arthritis was my secondary disease and that I was suffering from something else. Now, not only was I trying to deal with this disease, I was now faced to go through half a dozen additional tests to rule out his suspicions. Well, thankfully, in the end, I was cleared. Oh, and by the way, I didn't ask what that something else could be. I was emotionally and physically spent. I really thought I had hit rock bottom. Little did I know more was to come, and I'll get to that in a minute. My point, following treatment from the experts is one thing, knowing yourself is the other. The best expert for you is you. From time to time, you may need to advocate on your behalf. And it's my belief that developing a good rapport with all healthcare providers is critical in maintaining a symptom-free life. So, if you don't feel right physically, make that call. If you're seeking information, or emotional support, reach out to the Arthritis Society. Dawn and her staff are there for you. I did. In addition to my medication, I regularly see an osteopath, podiatrist, massage therapist, and chiropractor. Now, as Trevor had mentioned earlier, the hurt and the harm, if one of you feel that's where you are, I see a doctor by the name of Dr. Kelly who has a new technique called KST. And if anyone's interested, I'll share that later. Again, my point, taking medication is crucial in controlling your disease. Other forms of healthcare are essential in maintaining an active and productive lifestyle. Now, earlier I had made mention that I felt I hit rock bottom. Well, because of my big flare-up and associated swelling of my joints, I was faced with a few physical limitations, which I tried to continue to work through. With my rheumatologist's recommendation and additional medical support, I requested a slight accommodation at my workplace. Long story short, I faced 3 management unit grievance processes and an aborted arbitration hearing, finally settling out of court, consuming 20 months of my time, put my family through hell with my emotional roller coaster ride, and in the end, I won. I was finally granted my accommodation. Lesson: fight for what you need to make your life happy, comfortable, and respectful. Not everyone has empathy or even the slightest understanding of what arthritic sufferers go through daily. Don't give up. As I said earlier, face your challenges head on. And before I get the hook off the stage, let me leave you with this. I would encourage every one of you to look upon those around us and welcome them into your new family. Try not to look upon your disease as negative. Rather, look upon it as your special ticket into a very exclusive, caring family who are here to lend however many helping hands you may need. You need not journey these roads alone. Others have traveled them. Seek their advice. I did. And because I did, I stand here today happy to say I'm in remission. And have been, and have been for almost a year. Plus, I'm physically able to and have resumed most, if not all, of my activities that I was forced to stop in the beginning of this journey. Don't let your disease control you. You have the ability to control your disease. I wish you the utmost success in your journey. Good luck. Be strong. And thank you, Arthritis Society, for being there, when I needed you most. And to you, thanks for listening.